Great. Well, thank you for having me to the Cascade Centennial chapter. I really appreciate being able to speak to you. I'm actually in Hillsboro, Ohio, hanging out with some genealogy folks here this morning and thought I would go ahead and do the talk from here. So I apologize for any technical issues, but hopefully we'll get through all this. It's hard to do an interactive talk from Zoom, but I do want to try to incorporate questions or even comments. So please feel free to type things in the messages. I should be able to see those, or maybe if somebody there could bird dog those for me, I'd really appreciate it. Today, we're going to be learning a little bit about George Washington's health history, but as a setup to that, we're going to talk a little bit about colonial medical thought at the time. So hopefully this will be interesting, even outside of George Washington specifically. The reason I became interested in genealogy as a physician, and I'm an allergist immunologist practicing in California, was that I actually have a lot of family members who ended up in California for various respiratory ailments. So they had things like tuberculosis and other forms of croup cause regular respiratory ailments. And so they ended up coming to California pretty early in the 1870s and 1880s. And through that interest in family medical history, I actually started branching out and looking at genealogy as well. And so I don't know how many of you have done this thing, but this is a cause of death family tree. And this is a cause of death family tree for myself. It's actually, I'm a bit older, I'm 55 now. So, but you can see my parents are both still living. My grandparents died of more kind of chronic ailments like dementia and atherosclerosis. But as you go back further up the family tree, you start seeing a number of these different infectious diseases that our ancestors were exposed to. And these are the ones that really had played quite an effect on George Washington, as well as our ancestors who served in the American Revolution. So we're going to be talking a little bit about that, as well as how human beings have adapted to these infections over time. So this is going to be first talking about an intro into colonial era health, which actually goes way back into the time of the Greeks. We're going to talk about principles and treatments that were available. We're going to talk a little bit about inoculation, and then we're going to talk about George Washington specifically. So how did most people get their health care back in the 17th and 18th centuries? Who was their primary care physician? Well, essentially it was their mother. So most people received their health care at home. And treatments at home, ranged everywhere from nutrition to herbal remedies. Even minor surgeries were done at home. Medicine at that time was primarily learned from books, and I'm going to show you one of those. And most access to healthcare professionals was pretty limited for our ancestors back then. So you did have some hospitals in the big cities. You had physicians that were available. Physicians did double duty. They were kind of all over the place. Sometimes they were ministers because of their training and their literacy at that point. But you didn't really have the kind of medical professionals that we see to this day. One of the ways that women learned about how to take care of the family was through the writings of a guy by the name of Gervase Markham. Markham published a paper back in the early 1600s called The English Housewife. It later became a book. But chapter 1 was on the household physic. Physic is our old term for medicine. And he has here, of the inward virtues of the mind which ought to be in every housewife, and first of her general knowledges, both in physic and surgery, with plain and approved medicines for health of the household, also the extractions of excellent oils for those purposes. So this is basically chapter 1 of how to be a good housewife back then, was how to take care of the family, right? So this is Gervase Markham. And in this, you'll see a number of different remedies that were used for various ailments that affected our ancestors. For example, for headache, you shall take of rose water, of the juice of chamomile, and of women's milk, and of strong wine vinegar. So I don't know about you, but if I had a headache, that probably would cure my headache. When there were doctors around at this time, they were informed by the writings of men that had lived 1,000 or even 2,000 years before them, especially of Hippocrates and of Galen. Oh, am I ahead a little bit on your slideshow? It looks like it. Oop. My slide is different than what's on your screen. Shoot. Are we still connected?
Yes.
So I have the Germais Markham screen on, but now I'm talking about Hippocrates. There they go. I see them now popping up on my phone. So yes, when doctors were involved in the medical process, they often had read the texts of doctors that came before them 1,000 years before them, especially Hippocrates and Galen. And especially Galenic medicine is based upon Aristotle's writings of the four elements. Those are earth, air, fire, and water, or cold, dry, hot, and wet. And Galen felt like these elements corresponded with what they called the four humors, which were phlegm, black bile, yellow bile, and blood. And because of this, disease was an imbalance of these humors. At least that's the way it was thought. So a big part of diagnosing the patient, treating the patient, was using different forms of treatment to try to get the body back into balance. It's done a variety of different ways. You expunge the bad humors with phlebotomy or cupping or various even purgatives. And Galenic medicine became a whole thing where basically you would characterize different people based upon their physical characteristics, which then led into phrenology and some other areas of medicine that were not particularly scientific, especially involved with science of today. But you can see here, these are various charts looking at various types of patients who would have a lot of cholera or choleric, or they were phlegmatic. And you would basically look at different organs in the body to manage your treatments based upon the types of the different patients you were seeing and what diseases they actually had. And so on to the next slide. Part of the way that you expunged bad humors was through a variety of different techniques. And you'll see on this slide pictures of cupping, blistering. That is where a heated glass vial was placed on the back with the idea to draw out the bad humors under the skin. Sometimes the skin was lacerated to allow serous fluid to come out, and that would expunge the bad humors. Again, that was called cupping or blistering. There were also, essentially, this was doing the same thing, but with some sort of noxious chemical that would be placed on the skin, either directly over an area that was swollen or potentially an area that had been cut to allow those bad humors to come out. And then we all kind of know what a purgative or a medic or a laxative is. We won't talk about that since you guys just had your lunch. But again, these are ways that the doctors at that time used these ideals to remove bad humors. And you can see now where cupping is still used in certain instances. For example, in Olympic athletes or high-level athletes, there's cupping that's done even today. The idea is it's a little bit different. We're not pulling out bad humors, but what we're doing is we're drawing more blood flow into those areas of damaged muscle with the idea that it will help with the healing process and help a athlete recover a little bit more quickly. But obviously, you can actually overdo cupping. And the next slide shows a picture of that. Let's see if that catches up. Can you see that? There we go.
Yeah.
And I think this Galenic physician is probably getting sued for malpractice at this point. Another way to expunge bad humors is to pull out a blood in a technique called venesection. Now, venesection was done a couple of different ways over the years, but essentially what's happening is that you're taking a small blade and you're cutting an engorged vessel that allows the vessel to bleed. And then once you pull that blood out, that's going to help with the extraction of these bad humors. And you'll see some of the tools of the trade, so to speak. There are two bleeding bowls here. These bowls were often filled with warm water, and then an appendage was put inside the warm water to the blood vessel. And then you'll see here in the top right corner, there's a set of 3 lancets, different blades for different size blood vessels. And those were used to cut into the skin, open up that blood vessel, and then they would pour the water out of that dish and put the blood in there, and then they would get rid of it later. Those other 2 box-like implements are more modern versions of those lancets from the early 1800s. And venesection really was in favor until the 1820s, 1830s. In fact, Benjamin Rush was one of the last proponents of that Revolutionary War generation to still use venesection. And the other thing to keep in mind with venesection is there are a lot of blood vessels in the body. So you can imagine any blood vessel could be used for whatever ailed you. And this is a textbook from the 1500s, a German textbook showing all the different sites that you could use for venesection. And so they would open up these blood vessels and pull out the blood. And this will become important as we talk about George Washington a little bit. Now, this is a mortality, a disease and mortality bill from London on the year that George Washington was born, 1732. You'll see that coming up momentarily. It has a list of various diseases and casualties that people died from at the top. And it has a list in the bottom of the years that the patients or the people that died that year, how old they were when they passed away. And there are a couple of things. You can certainly see a lot of these old names for various ailments here. You know, consumption, colic, cancer, those are ones we would, recognize now. Asthma, being bedridden, even grief killed 14 people in London that year. The other interesting thing to keep in mind is at the bottom of this level, who have died, you can see a couple of things. You can see that there were people that lived well into their hundreds. So, about 130 people died ages 90 and up in London that year of the entire, 10,000 people that passed away. The other thing you notice is down at the bottom end, you'll see the under 2 years of age of that total number of people that died, 9,500 were less than 2 years of age. And obviously now we have immunizations, we have clean water, we have antibiotics. All of those things have fundamentally transformed our health history compared with our ancestors. And when you look at life expectancy back in the 16 to 1700s, life was short, nasty, and brutish. 17th century life expectancy was only about 35 years. That was English life expectancy, mainly due to that infant child mortality rate. Once you got into the colonies, it was even worse. So life expectancy was under 25 years of age in the early colony of Virginia. Now, you can also say that part of that was due to starvation and other issues with these stressed people, but still 25 years is not very old. In 17th century New England, about 40% died before reaching adulthood. That's everything from, being an infant all the way up and through teenage years. So now let's go back to George Washington and talk about George Washington, the setting of having that a little bit of a background in colonial era health history. So this is one of my favorite questions is what physical characteristics do we normally associate with George Washington? Does anybody have any thoughts on that? His height, that's right. He was tall. He was above 6 feet. He was 6 feet, 6'1", somewhere in there. What else?
Red hair.
He had reddish hair. Okay, yeah. I didn't hear that.
Rosy complexion, false teeth.
Oh, false teeth. Yeah, we're going to talk a little bit about the teeth. He certainly had dental issues by modern standards. Probably not necessarily by those standards, but he devised some interesting ways to deal with that. Well, one of the ways that we try to figure out what Washington looked like, what his physical characteristics were to look at various paintings or portraits of him. These are portraits that he actually sat for. And you can kind of see from these portraits, you can get hints as to his issues. This is a portrait from Charles Wilson Peale from 1776. And you can see he's got, kind of a round face. It's a little bit reddish. We talked a little bit about the hair. This is when he's a little bit older. You can almost see like a 5 o'clock shadow on his face. Um, some of his portraits, like this one from Joseph Wright during the Revolution, almost make him look a little bit chunky. But you can kind of also get a sense he's got these kind of ruddy cheeks. Um, this one is a little bit later in life, a few years before he passed away. This is done by a German artist, Adolf Wertmuller. And here he looks a little bit more statesman-like, a little bit more svelte at that time. He's got some experiences as president. But I think when we think about Washington and what he looked like and how that gives us clues about his health history, I really want you to remember this portrait of him by his fellow Mason, William Williams. This was done in 1794. And this is a painting that's still hanging in the Alexandria Masonic Temple in Alexandria, Virginia. You can go and actually see the original painting. I actually bought a full-size poster of it that's in my office at home. Because while it doesn't look like anything, yeah, he's got his Masonic gear on and everything. If you look up close, it gives you lots of clues as to Washington's health history. So I don't know how well the projection's coming up there or on your Zoom line, but what do you notice anything in this painting? I don't know if you can see my cursor, but over next to his right ear, there's a small either mole or what we think is maybe a basal cell carcinoma. Do you see that over at the right ear, right at the base of the right ear? If you look over at his left cheek, you'll see a contour of his left cheek. That's actually a scar. That scar was from a dental abscess. So that abscess was so bad that they couldn't access it by going through his mouth. And so they made an incision across his cheek. This is when he was younger, and they went and it basically took out one of his teeth through his cheek to pull it out because the cheek material was actually adhering to the side of his face.
Hmm.
There are a couple of small little bumps here and on the top of his nose and over here on his forehead. Again, I don't know if you can see my cursor or not. On the right side of his temple, just next to his right eye, there's a couple little light patches, 3 light patches. Those are pock marks from smallpox. So this artist actually drew the pock marks that were on his face from a bout of smallpox that he had that we're going to talk about. And it's hard to tell, but he actually has a couple little growths at the corner of his eyes, especially on the right side. Those are either little what we call syringiomas or could even be a little of a cholesterol deposition at that part of the eye. And of course, he's got like a 5 o'clock shadow and he's got, if you look up on his forehead, you think, well, maybe this is the way the painting is, but this is actually sun damage that's been painted on his forehead. He had kind of uneven forehead from being out in the sun most of his life. And so when you look at these things highlighted, they just stick out at you at kind of what his, past medical history showed. It's pretty impressive if you think about it. And the painting itself looks a lot better even than this projection. So that's what I want you to remember Washington. He was a guy like most of our ancestors. He had been through multiple different diseases in his life, survived them. He was essentially tough as nails. So one of the things we do when we have patients that come in first time in the office, what do? We get their medical history. And the first thing we ask about is what's their family history? So for Washington's family history, his great-grandfather was the immigrant ancestor. He was John Washington. He came for Hertfordshire to Virginia in 1756, and he died at age 46 from unknown respiratory ailments. His paternal great-grandmother was Anne Pope. She died at 33 due to unknown causes. His grandfather, Lawrence Washington, not his brother, but his grandfather, died at age 37 from respiratory disease. His paternal grandmother, Mildred Warner, died at age 30 from some unknown cause. And his father died of gout of the stomach, which was probably like a stomach cancer or ulcer in the stomach that was causing a great deal of pain before he passed away. So he had a lot of the same types of things that we see from most of our colonial ancestors. But look at his mother, Mary Washington. She died of breast cancer at 81 years old. And if she had had access to modern surgery, she probably would have even lived longer than that. So it's pretty impressive to see that some of these people still lived quite a bit back in these days. Now, what about Washington's past medical history? By the age of 15, he had measles, mumps, and black canker, which is diphtheria. So he had gone through a lot of those diseases that we now, I don't even, I've seen one case of measles, I've seen one case of mumps in my career because of vaccination. We just don't see that anymore. Diphtheria, I've seen a couple cases of that, but people do not get vaccinated at the same level, and that usually wears off after a period of time. So if you think about it, he was a surveyor, and he was surveying kind of the swamps around Northern Virginia. And so he also acquired malaria while doing this work. It was called ague at the time. And we know from family records that he was treated with Peruvian Jesuit bark, which is cinchona. That's basically a bark that contains quinine, which is a anti-malarial agent. And he had been treated multiple times in his life, so we think actually he might have had some hearing loss due to large doses of cinchona. Multiple people commented as he got older about hearing loss. Now, it could have also been cannons in the Revolution too. I don't know, but he definitely had gone through a lot, like most of our ancestors had. And one of the interesting stories about him when he was younger is that he had his older half brother Lawrence Washington, who he essentially modeled his life on. Lawrence was a prominent landowner. He was the one that owned Mount Vernon. Mount Vernon was named after Lawrence's commanding admiral, Edward Vernon, who fought in the War of Jenkins' Ear against the Spanish back in the 1730s, I think. And Lawrence was an officer in the Royal Marines, and he used his officership to gain status. He later became a member of the House of Burgesses. So he used his military service to then kind of go into politics, which is kind of how George Washington modeled his life as well. Lawrence, however, had terrible tuberculosis consumption and was affected by it for about the last half of his life. And he did a lot of different things trying to overcome his consumption. He had taken a variety of different medications. He had traveled up to Philadelphia trying to get doctors there, which was considered the top-notch hospitals of the day, trying to get him cured, but he could never get himself cured. So in 1751, he went to Barbados and he brought his younger half-brother George along with him. And the idea was that you would go to be near the ocean and it would help with overall respiratory disease treatment. And the whole point of that was to try to get out of Virginia and get into somewhere that was a little bit more healthy from a respiratory standpoint. The problem is that they stayed with the Gedney family of Barbados. The Gedney family is actually still around. They own a rum distillery that has been in operation essentially since this time. It's one of the oldest rum distilleries in Barbados. But regardless, they stayed with the family, and the family had a case of smallpox in one of the children. And sure enough, George ended up contacting smallpox in that day. He ended up being quite sick to the point where he was in bed for about 3 weeks while he was there. And there was some discussion on one of the books I read that he had almost died during that period of time. So because of that, that's why he carried those characteristic pockmarks on his face later in life. Now, when George came back to America, his brother Lawrence died not too long after that. He ended up inheriting the lands at Mount Vernon, and he also joined the colonial army to try to help the British, at this time during the French and Indian War. He served on the staff of Major General Edward Braddock and was involved with the campaign to capture Fort Duquesne in 1755. However, along the way, he developed dysentery, which was called bloody flux at that time, and he had to be left by the column. He ended up being treated for several days with a combination of salt, mercury, and bark, which is called Dr. James powders. And he eventually caught up to the expedition and joined them in time for the Battle of Monongahela. While he regained his health pretty well, he actually fought in a battle that was pretty much a one-sided victory for the French against the British. He had 2 horses shot out from under him. He had 4 bullet holes in his uniform, and somehow he escaped being shot at that point. It's one of the kind of providential stories about Washington that he went through this battle and kind of left unscathed. Unfortunately, his commanding officer, Major General Braddock, was not so fortunate. He was mortally wounded during that battle, ended up dying along the way, and they evidently buried him in the road so the Native Americans couldn't find his body. After the War of 1812, he kind of went through the War of 1812, excuse me. After the French and Indian War, Washington went through kind of a rough patch. He was affected by chronic diseases. Malaria kept acting up. His dysentery kept acting up. He was said to be dour and depressed from time to time. He fell in love with a married woman by the name of Sally Carey Fairfax of the Fairfax family. And he spent 4 months with flux with pleurisy and fever. So he was having issues with recurrent dysentery and diarrhea with various ailments with his chest as well. And because of that, he couldn't serve properly in the British Army, and he was persecuted for that. In the 1760s, as he gained more influence over Mount Vernon, he also became very interested in medicine. And he imported medical texts from England to learn how to work on not only family members, but also the enslaved people at Mount Vernon. He set up multiple infirmaries at Mount Vernon. He inoculated his slaves for smallpox, one of the first people to inoculate enslaved people in Virginia, which is pretty controversial topic of the day. And he even at one point learned how to perform venesection himself. So he was apt to lean towards bloodletting as a way to treat. So again, he was following those recommendations from people going all the way back to Galen in the ancient Greek times. Now, we actually don't know much about Washington's health during the American Revolution, and that's because it was a matter of national security. We've got a couple of small letters sent here and there about eyeglasses and various dental ailments, but we really actually don't know much about that time because it was just not written about, or the writings were destroyed at the point. This is kind of a fun thing I like to point out. This is a fake intake history and physical for George Washington as if he had been going into the Army nowadays, where it talks about his past medical history. It lists that he had malaria, smallpox, tubercular pleurisy, he had influenza, malaria and dysentery again. Goes through a variety of different things. And it's kind of funny because it has Benjamin Rush as the physician, but at the very bottom of this page, it says subject cannot be recommended for active duty in the field. And you can imagine nowadays, if you had all these ailments, you would never make it past the history and physical to get into the Army. But if you think about it, all of our ancestors had experiences like this. They had all gone through multiple different infectious diseases before they reached adulthood. Now, one important thing, and this was reinforcing Washington's idea that inoculation was a good thing, was the Siege of Quebec. Siege of Quebec took place in 1775. It was part of Arnold's expedition trying to capture Canada and cut off Canada from the British. It was a failure, and part of the reason why it was a failure is because the army moved up to Quebec and ended up sieging Quebec. And unfortunately, they also developed smallpox at the same time. And smallpox even killed one of their commanding officers, General John Thomas, who had not had smallpox up until that point. After that, Washington ordered inoculation for all Continental troops starting in 1776. And so it became the kind of mainstay of the Continental Army that if you were in the militia, you didn't have to get inoculated, but if you were in the Army, you did. And Valley Forge probably could have been a lot worse had the Continental Army not been inoculated for smallpox. So 10,000 troops arrive in Valley Forge in 1777. They make these makeshift tents before eventually constructing huts. Each of these huts held 12 soldiers. 4,000 of those 10,000 troops initially did not have blankets. About a quarter of them never had a blanket in their time at Valley Forge, and about 30% suffered disease. And while some of the discussions about Valley Forge being as freezing as it was were probably overplayed, still soldiers died of frostbite, gangrene, smallpox, typhoid, typhus, pneumonia, dysentery, consumption, malaria. They had everything there. About a quarter of the troops died during that year of at Valley Forge. One of my ancestors, Asa Bowdish, who was serving in the 1st Rhode Island Regiment at the time, ended up being put into the nearby hospital at Green Springs and was treated there during a measles outbreak during Valley Forge. So he was lucky that he himself didn't actually pass away. Now, we had talked a little bit about Washington's teeth. Washington would have owned dental implements like this. These were actually found at Mount Vernon during the 1790s, so maybe not necessarily his, but of that period. He had a lot of issues with his teeth, which he always blamed on cracking walnuts as a child, cracking walnuts with his teeth. His first tooth was pulled at age 22, and by the time he became president, he only had one tooth left in his mouth, one natural tooth. And we always talk about the dentures, right? Were the dentures made of wood? The dentures were never made of wood. The dentures were made of some combination of whalebone, hippopotamus teeth, and at time human teeth. So often at this time, extracted teeth were saved and later put back into the mouth in the form of a denture. But Washington himself actually paid the enslaved people at Mount Vernon for teeth. He actually bought 9 teeth from the enslaved people there for 122 shillings. There's a receipt for it. And these are some of his dentures that are on display at Mount Vernon or in the archives. So you can go and see these teeth that he actually wore in his mouth. At one point, one of his dentists was Paul Revere. Many of the silversmiths were also dentists because they would make these elaborate dentures. And he never probably really had any kind of well-fitting teeth. Nobody really did at that point in terms of dentures. So because of that, they said that his teeth clicked when he talked. And it may have been one of the reasons why he did not give long speeches and he generally did not smile. And we don't really see much in the way of portraits of him smiling. And he was, like I said, always kind of written about as a somewhat dour person. During Washington's pregnancy, he was ill for a good chunk of it. He developed a variety of different respiratory ailments during this time. He had another outbreak of malaria. He also developed an anthrax carbuncle, kind of like an abscess on his leg, and ended up having to undergo surgery with him being in bed for 6 weeks after the surgery. This is without anesthesia, without antibiotics. He developed conjunctivitis and also pneumonia during this time, and he was unable to perform his duties for a little over 3 months of his presidency due to various ailments that he suffered at that point. So you can imagine trying to deal with all these, uppity congressmen and senators and, then being so sick this whole time. But eventually, Washington was able to sit under his own tree back at Mount Vernon. He returned in March 5th, 1797 is when his term of office ended, second term of office. And unfortunately, he did not live long to enjoy the fruits of his and his enslaved people's labor. Thursday, December 12th, 1799, he'd been out riding his lands, inspecting it. It had been freezing with snow, hail, freezing rain. He arrived home late that night. He didn't change his bedclothing before supper. He started developing sore throat and dysphonia. Dysphonia is kind of a change in his voice and somewhat of a painful voice. He then retired early and noted that he was suffering from a cold. The next day, he developed more vocal pain and difficulty speaking. He also developed a cough at that point, and he retired early on Friday, December 13th. Early the next morning, 2 o'clock in the morning, he woke up in trouble. He was in respiratory distress. He had a sore neck. He had stridor, and he had fever. Stridor is an obstruction of the upper airway that presents like a wheeze in the upper airway. Martha called for Tobias Lear, that was Washington's secretary, pictured on the right there. Tobias Lear did some things helping to take care of him overnight, but then he called the farm overseer, which was George Rawlings, who came in, and because of Washington's belief in bloodletting, they let a quart of blood and they applied blisters. Remember, I was showing the pictures of the blisters in that earlier part of the talk. And they also noted that they removed this quart of blood despite Martha's objections. She didn't believe in venesection to the same level the other men did. Also, they gave him a formula of molasses, butter, and vinegar. Still, he did not develop any improvement. So I'm going to use this graphic as a way to understand how much blood that Washington lost over the course of the last day or two of his life. So roughly the blood volume for a man about 90 kilograms, which probably is about that size, maybe a little bit less. little over 6 quarts of blood. So they've now taken 1/2 of a quart of blood out from him. Okay. And so seeing that Washington was not getting better, they called for his friend and former head of the medical department for the Continental Army, Surgeon General, Dr. James Craik. And James Craik arrived at Mount Vernon. He assessed Washington and decided that he needed to bleed him another quart. Obviously, they hadn't bled him enough and they need to bleed him a little bit more. So at 9 o'clock, they bled 1 quart. And at 11 o'clock, they bled another quart. You know, when in doubt, keep doing what you're doing, right? You're obviously not doing enough of it. He also applied blisters to his neck and he gave him a gargle of sage tree and vinegar. And they also gave him an enema at that point. So if you think about it, gosh, what are they doing to this poor guy? They're trying to expunge all of those bad humors that they see developing in him. So they're bleeding him, they're giving him gargles, they're having spit that out, they're giving him enemas, trying everything they can to basically help Washington get better. So at this point, this is, less than 2 days after starting all this, they've bled out 2.5 quarts of his blood volume. Okay. Martha wasn't convinced by Dr. Craik's treatment. She sent for more physicians. About 3 o'clock that afternoon, 2 doctors arrived. Gustavius Brown was another family friend, older doctor, had also been serving in the Continental Army. And then there was a young, kind of more upstart doctor, Elisha Dick, who also arrived to help out. Elisha Dick had read about a number of different journals, especially in the French literature, describing a new technique called a tracheotomy for patients that develop stridor. Remember, stridor again is a wheeze from the neck. So when you have obstruction in the upper neck, you get that air going through, especially when you're short of breath, and you get this stridor. So he objected to another quart of blood being drawn by the older doctors and called for a tracheotomy. So at this point now, we're 3.5 quarts of blood down. So you can imagine the extra stressors that this puts on somebody's body when they're sick. They're having to move around less blood to try to oxygenate that blood. They have an obstruction in the upper airway, which is also blocking the oxygenation of blood. And it's making it more difficult for Washington to recover from this. And what we think was causing the stridor is a condition called acute epiglottitis. Well, there's actually a couple. He could have had what's called a peritonsillar abscess, which is an abscess basically in the back of the throat, develops from a bacterial infection and then ends up blocking the airway. But he could also have had an inflammation of his epiglottis. The epiglottis is the little flap that basically goes over your windpipe when you're drinking fluid or eating food. Now, you don't get that food going down into the trachea when you have this little epiglottis that blocks it. But that epiglottis can become infected, especially with forms of diphtheria and other respiratory ailments, and it becomes swollen and it can end up blocking the airway itself. So this is an x-ray on the left of a normal epiglottis. You see kind of up here on this little area. And then here is where it's inflamed and swollen, and you can see that airway is blocked at that point. Here's the airway down here. Here's the blocked area. Okay, so Washington's in trouble. And he knows he's in trouble. So later that afternoon, he calls for his secretary, Tobias Lear, to review his wills. He has he has at least 2 different wills, one of which is tossed into the fireplace. They keep the other one out. At about 5 o'clock, he changes into his bedclothes, realizing that he's not going to make it. The doctors tried to do a couple more things. They put cataplasms and some more blisters that were deployed. But at some point in the early evening, Washington asked for all the interventions to stop. And at that point, he thanked his physicians. He said, "Doctor, I die hard, but I'm not afraid to go. I believe from my first attack that I should not survive. My breath cannot last long." And it didn't. By 10:22 p.m., he died. And his last words were, "'Tis well." So here's a perfect example of doctors making a matter worse. It's an important lesson for us doctors. So that next Monday, Dr. William Thornton, who was then the chief surgeon general, sent a message to Martha asking whether she would be willing to allow him to perform a post-mortem tracheotomy. So in this day, there was a thought that when you died, that you were not completely dead and that you could be reanimated even in the hours after your death if certain treatments were done. And so he offered this post-mortem tracheotomy, to which Martha declined. And then, of course, various recriminations came. The older doctors were criticized quite a bit. Elisha Dick, I think, is eventually in history seen his place in all of this lauded over the years. So I think the important thing to remember about George Washington's health history is that he was affected by all these different diseases throughout his lifetime, and they were the same diseases that our ancestors all were affected by as well. He had measles. My ancestor Asa Bowdish had measles. People had consumption. Even my ancestors that I'm studying here in Brown County, Ohio, and Highland County, Ohio, many of them had consumption. This wasn't even treated until the early 1900s. So his medical condition tells us really about a greater story of life and health in colonial and revolutionary era that I think is really important for us to learn about. And mainly because nobody wrote really about my ancestor Asa Bowdish. Unless we're lucky, we really don't have a lot of information about our ancestors who served in the Revolution. But I think the most important point for me as a physician to remember is that George Washington's demise could have been avoided. He really had an unnecessary death. Now, again, by their standards of that day, that's what they thought was the right thing to do, and they were doing it. But even new medical ideas were coming into play, and they still weren't willing to accept new medical ideas. So for me as a physician, I think that's one of the things that I take away from his story. And those are my references, and that's pretty much the end of my talk. Are there any questions?
Do a round of applause.
Were you able to hear it? Hopefully, and it wasn't sequenced with the slides?
Yeah.
Oh, good, good. Any questions at all?
I don't know if you can hear us.
Can you hear us?
I can hear you.
No. Oh,
Oh. Any questions that might be delayed, but are there any? Does anyone got one or two questions? Yes, sir. Go ahead.
So what would have happened had the doctors never shown up? Would he have lived?
It's a good question. He could have still had a very similar outcome, especially if his airway was occluded. If he had not had a tracheotomy, maybe he was doomed to pass away anyway. But there is this natural aspect of the body to heal, right? And one of my ancestors was, a second great granduncle was the gentleman who invented osteopathic medicine. And his name was Andrew Taylor Still. And he was in Kansas and Missouri in the 1850s, 1880s, and formed the first osteopathic medical school. And he had some really interesting experiences during the Civil War, but one of the things that really influenced him towards osteopathic medicine was the patients that had been left out on the battlefield, that the doctors were not able to get into the surgical tents quickly, the ones who may have been out there for a couple of days, in some ways, they actually did better. And so his idea was that you would use osteopathic medicine to augment the healing of the human body, right? But it really depends upon the specific situation whether or not we think that Washington would have survived or not survived. Any other questions?
Well, thank you again. Thank you very much.
All right, thank you.